On this Saturday night, the coronavirus crisis in Hutterite colonies. The difficult new reality facing these tight-knit communities.
We eat together, we worship together, we work together.
Why some of these residents fear getting treatment. Face mask fines. What offenders in Alberta's two largest cities will have to cough up if they don't cover up. A Canadian-born hockey player takes a shot at a long-standing problem.
Racism is everywhere, and we need to fight against it.
A stirring speech as the NHL restarts. And communicating using a robot.
Having a video call is nothing like being with someone.
When being face-to-face won't suffice.
Global National with Robin Gill.
Good evening and thank you for joining us. There are warnings across the country tonight to stay vigilant this long weekend. Many provinces are seeing an uptick in COVID-19 cases. Health officials are concerned things could get worse if Canadians get too relaxed on this holiday weekend. That is often associated with friends and family getting together or traveling. 3 provinces reported new numbers today. There are 146 new cases in Quebec and 124 in Ontario. In Saskatchewan, there are 15 new cases. Health authorities say 9 of them are from multiple Hutterite colonies across the province. Across the Prairies, there is a surge in cases in several Hutterite colonies. It's causing those who live there to make some major changes in their day-to-day lives. As Global's Marnie Blunt tells us, residents are fighting 2 invisible enemies, the virus itself and the stigma it's causing.
They're small Christian-based communities nestled in rural areas of Canada. They're living rooted in agriculture.
And that's basically just part of our lifestyle, is the tight-knit closeness of our families, and we just support one another.
But some Hutterite colonies in Canada are facing adversity in trying to contain COVID-19 outbreaks. In recent weeks, hundreds of cases have been reported on colonies in Alberta, Saskatchewan, and Manitoba, many linked to local and intra-provincial travel. The outbreaks are forcing some colonies to go into lockdown and implement strict physical distancing measures.
For Hutterites, we've learned, and we're struggling to realize, that our communal way of life, the way we've organized our life for 500 years, poses some unique and very specific risks in regards to a viral outbreak like COVID-19.
And a lack of understanding those traditions is causing even more problems.
Hutterites have experienced legitimate concerns regarding stigmatization and cultural profiling. This has ranged from being turned away at doctors' offices, to being spat on, to being sent out of retail outlets. And this has resulted in Hutterites resisting testing.
It has many members of Hutterite colonies speaking out against stigma. In Manitoba, public health officials have stopped identifying colonies when reporting on clusters of COVID-19, a stigma that only hinders our ability to fight the virus.
COVID-19 does not discriminate. This virus can affect any one of us. And so it's systems, it's society that discriminates and not the virus itself.
A key reminder that kindness can go a long way in the fight to keep Canadians safe. Marnie Blunt, Global News, Winnipeg.
In Alberta's 2 biggest cities, masks are now mandatory in all indoor public spaces. Free disposable masks are being handed out in Calgary and Edmonton today. New bylaws require people to wear face coverings at all times in any indoor space the public has access to. Those include retail and grocery stores, shopping malls, recreation centres, churches, plus transit and taxis. In Edmonton, you could be fined $50 for not following the rules. In Calgary, the fine is $100. The majority of COVID-19 deaths in this country are linked to long-term care homes, and a new study out of British Columbia may have uncovered a crucial touchpoint in transmission. Nadia Stewart has more on the commonly used healthcare device that's at high risk of being contaminated by the virus.
Okay, just going to tighten for a minute there.
Of all the COVID-19 touchpoints, blood pressure cuffs might not have been high up on the list. But a Vancouver coastal health study is drawing attention to the equipment used in long-term care homes, identifying contamination on things staff use every day.
Some of the medical equipment that moves from room to room, things like blood pressure cuffs, an electronic medical tablet, and a linen cart were actually found to be contaminated with the virus causing COVID-19.
Researchers focused on 3 care homes while they were in the midst of COVID-19 outbreaks. 89 surfaces were swabbed, 6 samples tested positive for the virus. Of the 9 blood pressure cuffs swabbed, 4 were contaminated. Researchers say some care homes have found solutions beyond even more stringent sanitation.
And that includes having dedicated equipment. So for people who are known to be infected with COVID-19, for them to have their own equipment that stays put in those rooms and doesn't present a risk to others is one thing that some of the homes have taken on as a new step.
But measures such as this come at a cost.
For things like blood pressure cuffs, you do have an option of having one-time use, but the cost of that is extraordinary.
Mike Clausen of the BC Care Providers Association says care home staff will likely focus on enhanced cleaning because so many costs have increased in the wake of the pandemic. As researchers continue to look at the surfaces identified as hotspots, Clausen wonders where residents' personal items, the family mementos inside each room, fall on the risk spectrum. He says removing them should be done with careful consideration.
They take anything that they consider non-essential to the healthcare, they move it out and they store it. And then it becomes not their space at that point. And that's what's hard. And it's hard especially with people who have dementia or cognitive issues.
Person-to-person transmission is still the primary source of outbreaks, not these cuffs. But extra precautions will no doubt be taken all the same. Nadia Stewart, Global News, Vancouver.
In the U.S., July proved to be an especially difficult month in the fight against COVID-19. There were nearly 2 million new cases of the virus, and there are predictions that 180,000 Americans could be dead by the end of the summer. This is the harsh reality. And tonight, one of the hardest hit states dealing with a surge in cases is also bracing for a major storm. Here's Jennifer Johnson.
For 4 days in a row this week, Florida has hit a new COVID-19 death record. Now over 7,000 people have died from the virus in that state alone. And there's a new concern, Tropical Storm Isaias. Dozens of state testing sites have been forced to shut down. The entire east coast of Florida is on alert. Shelters are setting up physically distancing barriers, and officials are taking other precautions.
We have the non-congregate options available for people who may be experiencing COVID-19 symptoms, and a lot of that will be using hotels to be able to do that, and that has been something that's been prepared for.
In California, another milestone. It has become the first state in the U.S. to surpass 500,000 cases of COVID-19 as the virus surges there too. Doctors are still pleading with residents to wear masks.
If we don't get serious, ashes, ashes, we all fall down.
July turned into an especially deadly month for the U.S., with COVID-19 killing another 25,000 Americans. Texas recorded the most deaths last month. One doctor says they're fighting 2 battles.
A war against COVID and a war against stupidity. The first one, I have some hope about winning, but the second one is becoming more and more difficult to treat.
The Centers for Disease Control expects another 20,000 people could die from the virus in the next 2 to 3 weeks. A grim prediction as schools and colleges start to reopen. Some parents in hard-hit Arizona are being asked to sign COVID liability waivers. Many teachers are choosing retirement over returning.
I love those kids and where I taught and what I did, but I'm not quite willing to die for them.
Adding to the problems, a stalled economic relief bill in Congress. Pandemic unemployment benefits ran out for close to 30 million people Friday. More stress and uncertainty as Americans see no end to this crisis. Jennifer Johnson, Global News, Washington.
Mexico now has the 3rd highest COVID-19 death toll after the U.S. and Brazil. The virus has killed nearly 47,000 people in Mexico. The country's mortality rate almost triples the global average. The government says 3/4 of the dead had underlying health conditions. Mexico's president continues to deny the benefits of face masks, telling reporters he'll wear one when Mexico has no corruption. In South Korea, the leader of a secretive church has been arrested for allegedly hiding crucial information from contact tracers. Lee Man-hee heads a fringe Christian sect that is at the center of an outbreak in that country involving more than 5,000 cases. He's accused of hiding details on members and their meeting places. The 89-year-old is also accused of embezzling $5.6 billion in church funds. Prime Minister Justin Trudeau was forced to confront the We Charity controversy head-on this week when he testified before the Finance Committee about his ties to the organization and its founders. Farah Nasser is guest hosting the West Block this week. Farah, you spoke with the opposition leader about this, and what did Andrew Scheer have to say?
Hi, Robin. It's been another busy summer week in federal politics, with the We Charity controversy burning up more oxygen for the Liberals. On Thursday, the Prime Minister was grilled for over an hour by members of the opposition. This week on the West Block, we're speaking with Andrew Scheer, the leader of Canada's official opposition. He's been grilling the Prime Minister on the We Charity controversy for days, as have some Conservative MPs. Scheer is accusing Justin Trudeau of sidelining Parliament, but the Liberals aren't the only ones who have been accused of that. I asked Scheer what he thinks about the fact former Prime Minister Stephen Harper was criticized about shutting Parliament. Take a listen. You've criticized the Prime Minister for sidelining Parliament, but your party's former leader, former Prime Minister Stephen Harper, prorogued Parliament 4 times. So isn't this type of criticism a bit rich?
Not at all. Prorogation is done at the provincial level, at the federal level regularly. It's a normal part of the parliamentary cycle. What Justin Trudeau has done has effectively sidelined Parliament in the middle of a pandemic since March. There's a lot of reasons why Parliament needs to be sitting. There's absolutely no comparison at all to a normal parliamentary cycle that may have been done in the past.
Canada's brand new ambassador to the United Nations, Bob Rae, joins me on the show too, just days before he begins his new role. We'll ask the former interim Liberal leader if the government should have seen this controversy coming. Also, today marks 600 days since China imprisoned the 2 Michaels. Rae says he rejects calls to free Meng Wanzhou and end the extradition process.
We're dealing with a country that has obviously taken huge exception to the decision by Canada to respect our extradition treaty. And I think most people, again, feel quite strongly that we have a treaty with the United States, as we do with a number of other countries. And we're not in a position to fool around with that treaty.
I'll also be asking the new ambassador about some of the frank opinions he's voiced about Donald Trump in the past. All that and much more on the West Block. Robin.
All right, thanks for that, Farah. And you can watch the West Block right here on Global tomorrow morning. Celebrating the end of slavery. Coming up, how Emancipation Day was marked in one Canadian city. Plus, an NHL game like no other. One player's powerful speech about racism. There are marches across the country for the annual celebration of Emancipation Day, marking the abolition of slavery in Canada over 180 years ago. Demonstrators called for an end to ongoing anti-black racism and racial violence by police. The march comes amid months of anti-racism protests around the world, ignited by police killings of black people in the U.S. An NHL player is getting support for his anti-racism message as the hockey season restarts.
Racism is a man-made creation. Hockey is a great game, but it could be a whole lot greater, and it starts with all of us.
Matt Dumba is from Regina and now plays for the Minnesota Wild. He took a knee during the American anthem. The 2 teams then faced off in their first game of a shortened season. 2 hub cities, Toronto and Edmonton, are playing host to the NHL. The teams are going straight to qualifying rounds for the Stanley Cup playoffs. Of course, no crowds were present because of pandemic restrictions. As we mentioned earlier in the newscast, Florida, which is struggling to contain COVID-19, is sitting in the crosshairs of tropical storm Isaias. It could become a hurricane again when it hits the state's east coast.
So now everyone should be safely staying at home. Do not go out unless you really need to.
As always with these storms, power outages are inevitable. 2,000 workers from 10 other states have been brought in to help restore electricity. The hurricane already blasted through the Bahamas and Cuba, causing floods and damaging buildings. About 200 homes have been evacuated in Southern California after the apple fire ignited near the Cherry Valley community. The wildfire started on Friday evening and has scorched nearly 800 hectares since it began. So far, no injuries have been reported. The blaze is one of several fires being fought around Southern California as the region deals with a record-breaking heat wave. Amid natural disasters and a pandemic, the U.S. president is waging a new war with China over a video sharing app. Donald Trump is threatening to ban TikTok from the U.S. Up to 80 million Americans use the Chinese-owned app per month. TikTok has denied accusations that it's controlled by or shares data with the Chinese government. Trump hasn't said when or how he'll enforce the ban. Breakthrough therapies still ahead, the new drug therapies in Canada for COVID-19. It's been 5 months since Canada reported its first case of COVID-19. We're far from a cure, but potential treatments have been developed at record speeds. Heather Yourex-West looks at the promising drug therapies underway across the country.
In the race to find new therapies to fight the novel coronavirus, one of the biggest breakthroughs came when scientists in England discovered that a cheap and readily available steroid drug could effectively treat patients with COVID-19.
Prior to the last few weeks, you might have only had maybe about 50% of doctors that were using steroids in patients with severe COVID lung injury. Now, I'd say almost 100% of doctors are using steroids in this population.
Dexamethasone doesn't target the virus itself. Rather, it works to treat inflammation caused by COVID-19. In a large clinical trial, the drug was found to help prevent 1 death in every 8 COVID-19 patients on ventilators.
So the dexamethasone right now is the therapy that I would say would be leading in terms of its benefit to patients. And then the next one that I mentioned was the remdesivir, which is the drug that specifically targets the coronavirus itself.
The antiviral drug has shown promise in clinical trials, both in shortening the duration of illness and reducing mortality. But the drug was only recently approved for use in Canada.
At the beginning of the pandemic, we were using it on a special access permit, but it took many days to obtain, so it really wasn't practical.
Meanwhile, another therapy that received considerable buzz early in the pandemic, thanks to endorsements from the U.S. president, failed to deliver results when examined in clinical trials.
I think everybody is pretty convinced that hydroxychloroquine does not work for COVID-19, and we were never using it here outside of clinical trials, but nowhere, I think, is using that even anecdotally now.
Of course, none of the new therapies are considered cures by any stretch, but when compared to what was available to physicians just 6 months ago, it's clear that in a very short period of time, the way this new illness can be treated has come a long way. Heather Yourex-West, Global News, Calgary.
Up next, the self-described geek who thinks this robot is the answer to those dreaded Zoom calls.
The flag's all yours. It's been a pleasure.
Astronauts Doug Hurley and Bob Behnken were awarded one of the International Space Station's American flags today as they prepare to leave the station, ending an historic mission by SpaceX. 2 months ago, the astronauts helmed the first ever launch of a manned private spacecraft, as well as the first manned launch from U.S. soil in nearly a decade. They're expected to be back on Earth tomorrow. The pandemic has forced all of us to find new ways to stay connected with loved ones. But a Skype or Zoom call isn't quite the same as a chat face-to-face. And that got one British toy designer thinking. As Redmond Shannon explains, he's come up with a cheap and safe way to transport yourself into someone else's home.
Ross Atkin is a proud geek, a design consultant who's never stopped being the kid obsessed by Lego.
Yeah, I feel like the first job I got in design, I was like, really? They're going to pay me to design stuff and, build models and do CAD and Illustrator and stuff? Because I was like, I'd just do that, I'd do that. I was doing that anyway.
He's been designing self-assembly robot toys for 5 years. And when the whole world started Zooming each other during the pandemic, a thought occurred to him.
Having a video call is nothing like being with someone. because you're stuck in this little rectangle and you're completely dependent on what they're doing with their rectangle.
So Atkin very quickly designed this.
And I can turn right.
A cardboard telepresence robot
And I can do that.
using a simple smartphone app. Large telepresence robots for offices can cost thousands of dollars. Atkin's model, funded by a Kickstarter campaign, costs about $100 and is more about engaging small kids than big clients.
Being able to just leave the grandparents or the in-laws in the robot to chase the toddler around themselves without having to follow him around holding the phone. That then meant both of us could do something. He could play and they could still interact with him.
It's not a substitute for babysitting, but it does add a new level of interaction for kids of all sizes, even news reporters too. Although I could have used a rear camera. Atkin also designs products for people with disabilities. He thinks larger versions could have many applications beyond the pandemic.
You can make some care tasks a lot more convenient for the carer and for the person being cared for, and you can end up with the carer being able to spend more time caring for the person because they aren't having to travel.
Being a tiny robot is not quite face-to-face contact, but as we've all learned in 2020, technology and clever design can help us feel that little bit closer to our loved ones. Redmond Shannon, Global News, London.
And that is Global National for this Saturday. I'm Robin Gill. Tonight, your Canada is the town of Indian Head, Saskatchewan. We'd love to see your corner of this country, so please email your photos to viewers@globalnational.com. Thank you for watching, and I'll see you back here tomorrow. Have a great night.